Okay, so now we're going to look at pronator teres. Now, pronator teres is, I love pronator teres. If we're looking at clients that are coming in and having issues with supination, pronation, okay, so being able to flatten out and open their arm, then obviously pronator teres is a big one there. And obviously the pronator quadratus down here as well, they both assist each other in that. So not hard to find on young Seb here. You can see the bulk of it there. I'll just roll off it, okay? That is pronator teres there coming all the way over. So if we have a look at pronator teres here, here it is here. So we've sort of come out to the medial epicondyle and comes all the way across here, okay, and then sort of blends into that, basically that radial aspect of the bone, okay, down in this area here. So just a short muscle, obviously has a great trigger point here, but what's really important about pronator teres, I'm glad you ask, is the median nerve comes down through here in between basically the bicep brachii and the brachialis and comes underneath the pronator teres. So it is a integral part of mimicking sometimes or being an adjunct to carpal tunnel syndrome down here as well. So it can get entrapped on that pronator teres there. And because once again, young Seb is a rock climber, he will be using this muscle a lot. Okay, so not hard to find. I'm flicking over the muscle there like so. So we can see it coming across here. That's pronator teres there. And got our flexor carpi radialis, palmaris, and obviously our flexor ulnaris. Okay, so let's have a look at how we treat it. It's actually not that difficult because it's only a short muscle. So it's not a lot of long stroking there. Once again, it's really important to assess what sort of supination they are. Can they actually have their arm flat on the table like that? People who have a really tight pronator teres will be sort of having their arm in that situation. So the fact that we can open this up is a good sign, okay? Especially for people like, believe it or not, lawn bowlers. So they really like to deliver the ball with an open hand, and if they're not able to do that and they're quite tight there, then obviously it makes it difficult for them. It goes with anyone in terms of throwing or delivering a ball. So we're going to come across here. Okay, so we're going to start basically down in this area here, and we're going to work our way up and over. Okay, so I'm going to pick up a little bit of some of the other flexors, but then as we move out medially, okay, out towards that epicondyle area, that's where we're going to pick up that bulk of the pronator teres. And as I said, median nerve runs under it, so it can get entrapped under there. So if we are getting some sort of paresthesia or pins and needles, make sure to tell your clients it's no drama. It's just the fact that there may be some interference there with the median nerve. So I'm going to open it up here and then work basically obliquely, okay, or diagonally across the muscle itself, okay. So once again, the trigger point will be in the belly of the muscle through here, okay. And, you know, once again, it's a muscle that can refer in a few different areas. From a clinical point of view, I know the classic sort of trigger point referral of Travell and Simmons is it can refer down sort of along in this area here, but you'll find the bulk of the referral sometimes down here, and it can mimic, once again, sort of neural pain from the median nerve as well. But we're going to keep it simple, use the KISS method, keep it simple, stupid, and just work across and open it up, okay? So we want to try and engage as much of opening that up across, and we want to sort of stay away from butting up once again into that elbow crease. We just want to follow the muscle around like so. Okay, Not rocket science, pronator teres. Once again, it's all about assessing how much range of movement they have there, And, once again, you can, pronator teres is one of those muscles that obviously you can test and retest. We can get them to go into resisted supination, okay, going that way. So we'll bring it up a little bit, and then we can do the opposite of him coming back the other way as well. So it's a really good rule of thumb, in terms of treating that muscle, okay. Opening it up and working across, and we'll hit that trigger point right in the belly of the muscle about there, like so. That's pronator teres. Okay, once again, flexocarpal radialis coming down here. And if we were to hit palmaris, we'll be out here. And if we're hitting ulnaris, we'll be out there. So we just know our locale, as I said, using that main index finger knuckle all the way through there. Just slow and purposeful. Get a little bit of flexion and extension of the fingers and the wrist. Stop short there. Come back down again. So this is the area we're looking at, really focusing on in regards to that trigger point through there. Okay, so up. Keep that flexion extension going and blend off. Flexocarpi radialis.